The process through which lasers heal damaged, injured tissue is called photobiostimulation. Lasers are optimal for three primary processes. 1. Pain relief. 2. Inflammation reduction. 3. Tissue repair. Flooding damaged, injured, aged, inflamed tissues with light photons, energized cells, promotes increased blood flow, as well as production of pain reduction chemicals such as endorphins and enkephalins from the brain and adrenal glands. The result is significantly better oxygenation, promoting faster recovery of damaged, injured cells and pain relief with a cascade of healing mechanisms of action the body naturally employs. Berman medical high-intensity therapy lasers utilize a process called photobiomodulation to effectively and efficiently change the condition of the damaged, injured, aged tissue by stimulating cellular metabolism via a coherent light source, thereby engaging and stimulating the body's own mechanisms of action to accelerate the healing process while providing the patient an overall feeling of pain relief, increased range of motion, and a degree of normalcy and well-being. One of the key factors to achieving sustained successful outcomes during the application of a high-intensity laser utilizing the therapy aspect of a multi-use, multifunctional laser, more appropriately termed photobiomodulation therapy, is to modulate the energy of a sufficiently large number of aging, damaged, injured, or malfunctioning cells to produce a measurable, clinically meaningful response in a short period of time. Biomodulation and photoacoustic waves are created when the area is irradiated and saturated by using relatively long 20,000 Hz or greater frequency repetitions, rapidly producing pulses referred to as continuous wave, termed CW, or conversely shorter duration pulses referred to as pulsed wave, with high repetition rate, termed pulse. Both types of mechanical waves stimulate free nerve endings in the tissue and cause nearly instantaneous pain relief in the target area. To adequately discuss photobiomodulation dosing, it's best to start by describing a few terms involved in its definition, most importantly being energy. Light's total energy striking a target is the addition or accumulation of all the individual energies of small packets of light called photons, reaching such target over a predefined period. Trained technicians determine the target area to be treated so the dose applied has taken the absorption characteristics of any intervening tissues into consideration. The International System of Radiometric Units uses the joule, J, as the unit of energy measure and the watt, W, or joule, J, per second as the unit of power. At any specific wavelength of light, every photon contains exactly the same amount of energy. The intensity of the light, its brilliance or irradiance, is given in watts per centimeter squared, and it describes the density of photons striking a given surface area per unit of time. Power density is a crucial and key factor to sustain positive outcomes. The factor irradiance is critically important in achieving the therapeutic dose of light to target tissue, resulting in a positive sustained outcome. High-intensity lasers non-invasively penetrate the skin surface, administering lights resulting in rapidly spreading photons of energy into the subcutaneous fat, muscle, tendons, ligaments, and bone tissue, ultimately arriving to and saturating the target area. Treating above, proximal, and below distal, as well as 360 degrees around the target area while periodically articulating the structures immediately associated to the target area will culminate in better sustained positive outcomes. A convex treatment head can be used to compress the superficial tissues, displacing excess fluids and enhancing laser penetration into deeper structures. There are three key parameters to consider to achieve adequate irradiance while safely delivering an effective dose of light energy to the target and surrounding tissue. 1. The condition being treated. 2. The absorption characteristics of any intervening tissues between the light source, commonly referred to as the handpiece, and the target tissue. And 3. The mechanism of delivery, inclusive of the spot size of the lights, continuous or pulsed waves. Consideration of the condition being treated requires an understanding of the location of the target tissues, taking into consideration how far the site of the injury is below the skin surface, and what types of tissue the light's energy must travel through to reach it, taking into consideration the color of the skin, age of the patient, and size of the target area. Take note. Tattoos greatly inhibit the lights from penetrating the skin into deeper structures, and the light's loss from penetrating is substantial and immediate, resulting in potential overheating. Practical and quantitative research of light's losses as it travels through the various tissue layers of skin, fat, muscle, ligaments, tendons, and other structures of the body has shown that light intensity at depth, which is a key factor, is proportional to the intensity applied at the skin surface. High-intensity lasers drive a proportional quantity of photons to deeper target tissues and structures. High-intensity lasers utilize higher watts of power to treat target areas in a shorter period of time with the added benefit of proportional energy driving photons deep to reach lower target tissues and structures. As light energy travels through tissue, photons will either be reflected, scattered, absorbed, or transmitted at proportions that depend on the tissue's optical characteristics, primarily the tissue's absorption and scattering coefficients, which are wavelength dependent. The therapeutic window of 600 to 1200 nanometers needs to be considered, with the range of 800 to 1000 nanometers being the most studied and utilized far more often by physicians for therapy. In order to achieve a clinically significant response, a sufficiently large number of photons must reach the target tissue and be absorbed by target tissue chromophores. The body's own mechanisms of action will engage and positive outcomes ensue. Again, upon application of coherent laser light on tissue, there are 4 different effects that occur. Reflection, the light doesn't penetrate the tissue. Scattering, the light is distributed randomly in the tissue. Absorption, the light is absorbed by the molecules of the tissue. And transmission, the light is transferred deeper into tissue structures being appropriately absorbed. As lights flood tissue, photons are absorbed. Lasers operating in the near-infrared spectrum from 800 to 1000 nanometers penetrate into deep tissue structures. Lights that penetrate into the target tissue are absorbed by melanin, hemoglobin, oxyhemoglobin, water, and more. Energy from these absorption events will be dissipated as heat, generating a warm, soothing event in the target and surrounding tissue. This soothing warmth helps relax muscles, tendons, ligaments, and additional structures, promoting an overall relaxed well-being feeling, while range of motion dramatically is enhanced and pain is rapidly dissipated. Deeper target tissues require greater irradiances, a larger dose of photon energy being applied at the skin surface, either a longer period of time for a low-intensity laser or a shorter period of time for a higher-intensity laser, for a fixed set of treatment parameters. Condition being treated, tissue type, and mechanism of delivery. The photobiomodulation dose can be described in terms of the energy density expressed as joules per centimeter squared. Dose relates to the energy delivered at the skin surface needed to appropriately saturate a defined volume of the target tissue with light. For any given treatment area, the treatment time can be determined with a relation to the treatment power watts, W, and the total joules, J, to be delivered as joules equals power times time in either seconds, microseconds, or milliseconds. Regarding the power setting, clinicians and technicians should choose the optimal irradiance or power density that minimizes surface heat, yet produces the desired treatment effect. To minimize surface heat, clinicians and technicians simply utilize a slow constant movement of the handpiece over the entire target area in an S pattern to achieve the desired outcome. For therapeutic dose of energy to safely and efficiently reach deep target tissues, the absorption characteristics of intervening tissue layers such as hair, skin, fat, and muscle must be considered. Wavelengths of light in the near-infrared spectrum between 600 to 1200 nanometers are commonly used for photobiomodulation therapy and are within what is termed the therapeutic window, so called because these wavelengths not only penetrate through the appropriate tissue layers to varying degrees, but are also absorbed by the chromophore of interest in the mitochondrial membrane cytochrome C oxidase, which mediates the photobiomodulation response. For photobiomodulation to induce any biological response, the light's energy must be delivered to the injured damaged aged cells at the target and surrounding tissues and absorbed by this chromophore. Further consideration of the light absorption characteristics of the intervening tissue layers must be considered to minimize surrounding tissue overheating and energy losses as light penetrates to deeper target tissues. The enzyme cytochrome C oxidase, or complex 4, is a large transmembrane protein complex found in bacteria, archaea, and in eukaryotes in the mitochondria. It is the last enzyme in the respiratory electron transport chain of cells located in the membrane. In order to examine these absorption characteristics, the relative contents of other non-target chromophores within tissue layers should be considered. Take note that the primary chromophore that acts as a barrier to light penetration to deeper tissue layers is melanin. Melanin approaches 2 times greater absorption at 810 nanometers than at 980 nanometers. Thus, when treating through dark dark hair or dark skin with high melanin concentration, it's more efficient to do so at 980 nanometers. The final factor in delivering an effective laser therapy treatment is a mechanism of delivery. The primary target for photobiomodulation is a cytochrome C complex, which is found in the inner membrane of the mitochondria. Cytochrome C is a vital component of the electron transport chain that drives cellular metabolism. As light is absorbed, cytochrome C is stimulated, leading to increased production of ATP, adenosine triphosphate, which is an organic compound and hydrotrope that provides energy to drive many processes in living cells. For example, muscle contraction, nerve impulse propagation, condensate dissolution, and chemical synthesis. In addition, ATP laser stimulation produces nitric oxide and reactive oxygen species. Nitric oxide is a signaling molecule in many physiological and pathological processes. Nitric oxide is a powerful vasodilator and an important cellular signaling molecule involved in many physiological processes within the human body. Reactive oxygen species, known as ROS, have been shown to affect many important physiological signaling pathways, including the inflammatory response within the body. In biology, cell signaling is part of any communication process that governs basic activities of cells and coordinates multiple cell actions. The ability of cells to perceive and correctly respond to their microenvironment is the basis of development, tissue repair, and immunity, as well as normal tissue homeostasis. By understanding cell signaling, clinicians may treat more effectively. The production of these signaling molecules has been shown to induce growth factor production to increase cell proliferation and motility, and to promote extracellular matrix deposition and pro-survival pathways. Outside the cell, nitric oxide signaling drives vasodilation, which vastly improves microcirculation in the damaged, injured target and surrounding tissue, delivering much-needed oxygen, vital sugars, protein, and salts while effectively removing waste. A significant obstacle to delivering an appropriate level of photons to target tissue is reflection. When laser light enters the skin through non-direct skin contact delivery, up to 5% of energy may be lost due to reflection off the skin surface. In addition, some light energy is lost due to scatter or redirection of light from a straight path as it travels between different media. Scatter and redirection mean the energy is going in various directions and not directly to the target area. To effectively deliver the appropriate photon dose to deeper target tissue, direct skin contact delivery techniques prove more effective. Utilizing a convex treatment head can compress superficial tissue, displacing excess fluids and enhancing laser penetration into deeper structures. There are three primary therapeutic advantages related to direct skin contact delivery. These include tissue contact, which when properly implemented minimizes light energy losses due to reflection at the air-skin surface interface. Second, tissue compression, which lessens absorption and scattered losses in the compressed tissues by shortening the distance the light must travel to reach the target tissue. And finally, blanching, as the compressed tissues remove superficial blood from the area, minimizing incidental photonic loss from blood absorption. These factors attenuate, inhibit, and reduce photon penetration to deeper tissues and structures. When treating via non-direct skin contact, larger amounts of energy is necessary to deliver to and for the target tissue to receive the same number of photons at depth. When treating with direct skin contact, reflection from the skin as well as absorption and scattering intervening tissues are reduced, resulting in a more efficient delivery of energy. In summary, delivering safe and maximally effective photobiomodulation therapy requires a working knowledge not only of the conditions being treated but also of the tissues through which the lights must travel to reach the damaged, injured tissues, surrounding tissues, and structures. Consideration of both methods, coupled with the ability to make adjustments and the mechanism of light's delivery, will ensure that an optimal dose is being delivered to the target tissue. Human tissue is composed of various components, of which the most important for laser irradiation are water, hemoglobin, and melanin. Their absorption as well as scatter coefficient are different for different wavelengths. Direct and non-direct skin contact whilst administering irradiation. Oxygen is processed in cells by mitochondria. Oxygen is processed by a cascade of respiratory enzymes and delivered to ATP synthase, which synthesizes the organism's source of energy, ATP. A faster exchange of oxygen and metabolites due to laser radiation causes more oxygen atoms to reach mitochondria. Mitochondria are further stimulated to synthesize ATP faster by laser irradiation at 800 to 1000 nanometers. ATP allows for faster synthesis of RNA and DNA and leads to faster recovery, healing, regeneration of cells, edema, and swelling reduction in the treated target area. Biostimulation is stimulating the organisms on the cellular level for enhanced healing and recovery. 980 or 810 nanometer laser lights photons being administered is one of the key effects of a Berman medical high-intensity laser, culminating in desired sustained positive outcomes. The thermic effect of high-intensity laser therapy is caused by absorption of the 810 or 980 nanometer laser lights into the superficial structures, which consequently create temporary temperature increase in the target and surrounding tissue. Thermic effect causes vasodilation. As a consequence, blood perfusion increases, larger amounts of oxygen are delivered to the tissue, and more metabolites are resorbed. Bottom line benefits of laser therapy. 1. Increased synthesis of ATP, RNA, and DNA. 2. Increased tissue oxygenation and nutrition. 3. Increased rate of tissue, nerve, and cell regeneration. 4. Increased lymphatic drainage, vasodilation, nutrient transport. 5. Increased range of motion. Photobiomodulation therapy promotes rapid pain relief, reduction of inflammation, and the regeneration of tissue, culminating in the repair of the damaged, injured tissue while the patient experiences pain reduction, a feeling of well-being, and normalcy for a sustained period of time, enabling the patient to live their lives on their terms and with the quality of life they desire.